Hey Jill, we have a quorum. We can start whenever you're ready.
Okay, Keisha, I'm coming, hold on.
No
But,
problem.
well, no, it is 12:50. Oh, my camera's not on. My bad. Alright, it is 12:56. And I'd like to call the meeting to order. Keisha, would you mind calling the roll?
Not a problem at all. All right, Dr. Baravecchio? Mr. Bennett?
Here.
Mr. Bennett's here. Mr. Billings?
Here.
Mr. Billings here. Mr. Blunsky?
Here.
Mr. Blunsky here. Ms. Shashery?
Here.
Ms. Shashery's here. Ms. Crane?
Here.
Ms. Crane is here. Mr. Hanks? Ms. Harmon?
Here.
Ms. Harmon's here. Ms. Kelly Aduli?
Here.
Ms. Kelly Aduli's here. Mr. Macaluso? Ms. Nguyen? Mr. Smith? Mr. Williams?
Here.
Mr. Williams here. Ms. Zhu? Okay, we have 8. We have a quorum, Jill.
Okay. Thank you, Keisha. Alright, before we get started, can you also read the ground rules?
Yes, ma'am.
Keisha?
All right. I just want to remind you guys there are a few ground rules. For committee members and members of the public attending in person, please raise your hand to speak and wait to be recognized by the chair before speaking. To help the meeting run smoothly, please keep side conversations to a minimum and comments related to the topic we are discussing. For those committee members who are attending virtually, remember you must be on camera and have your first and last name showing to be counted toward the quorum. Please keep microphones muted unless called upon by the chair. Electronically raise your hand to request to speak and wait to be called on by the chair. For attendees, electronically raise your hand to request to speak. Once recognized by the chair, your microphone will be turned on. After speaking, the microphone will be returned to mute. Also, the Q&A is to only be used by those needing an ADA accommodation to participate in the meeting. Public comments will not be accepted via the Q&A except for those individuals who requested the accommodation. As for order, committee members in person and virtually will be allowed to speak first. Public members in person will then be called on, followed by public participating virtually who have their hand raised. Comments in the Q&A will be addressed last. As with all hybrid meetings, it is very difficult to keep track of all of those wanting to speak and virtually, so please be patient. All comments and questions from the public may be subject to 2 minutes at the discretion of the chair. So please keep in mind, depending on the time constraints, we may also limit comments to one per issue. Also, comments about a person's character will not be allowed. Finally, members of the public will have the opportunity to provide public comment before each vote and during the designated public comment periods. The chair may also use their discretion to determine if comments will be accepted outside of those times. Okay, Jill, the floor is yours.
Thanks, Rikisha. I'm having issues with charging my computer. Okay, so now we have to approve the meeting summary. Can you put that on the screen? Everyone, never mind. Everyone should have reviewed the April meeting summary, which is attached in the agenda, and you received via email, and there is also a copy in your committee packet. I need a motion to adopt the April meeting summary.
Mike has his hand raised. Jill.
Okay, Mr. Billings.
I make a motion that we adopt the April meeting summary as submitted.
Okay, Mr. Billings, a motion to adopt the April meeting summary. Is there a second?
Mr. Blanchard has his hand raised.
Aiden? I'm sorry, Aiden, did you second?
Yes, ma'am.
Okay, Mike Billings. Okay, hold on. Is Aiden Blunsky second? Is
Yeah.
there any discussion? Any public comment? Thank you. The April meeting minutes have been accepted. Now we are on the non-contractual updates. Mr. Bernard Brown.
Mr. Bernard had to step out for just a second, so he has asked to go last. So if you want to go ahead and move on to Mr. Brian Bennett.
Okay, so Brian, could you please continue our LDH or start our LDH updates? Will you provide us from updates with updates from Medicaid?
Sure, Jill. Hi, everybody. I'm Brian Bennett from representing the Medicaid agency. I'm going to give a few updates related to some legislative items from last session, and even one that was tied to a bill from the 2025 session. So I'll start with that one. House Bill 1 from the 2025 regular session allocated some funding for durable medical equipment rates. So we are working right now to increase rates for certain what we call DME or durable medical equipment items and services to align those with their the rate that's paid by the Medicare program. Specifically, those will include orthotics and prosthetics, diabetic shoes, including fitting for the shoes and any modifications, and compression garments. So the rates for those items will be increased basically to align with what Medicare pays for those items, so that they'll be the same between Medicaid and Medicare programs for our DME providers. Also in the 2026 legislative session, House Bill 222 was passed, and that's involving dental services. So what that does is it adds coverage of dental procedures for a Medicaid beneficiary if the procedure is medically necessary in order for the individual to be cleared to receive a procedure, a Medicaid covered procedure. So if the doctor or the clinician says that this individual needs this type of dental service in order to have, let's say, a surgery, that's what this bill provides. It adds coverage just for those services, dental services or procedures that are medically necessary in order for the individual to be cleared for another service or procedure. Again, that was coverage and funding for that was provided by House Bill 222. We're referring to that as medically integrated dental care. And this will primarily affect our adult population that currently is only able to access denture services through their dental benefit coverage. I think for children on Medicaid, they already have comprehensive dental coverage, and then those enrolled in one of our OIDD waivers or residents of ICS also have comprehensive coverage. So this would mainly impact those adults that currently only have access to denture services. And assuming CMS approves our state plan amendment that we're submitting, we're aiming for a January 1st implementation date for that. And I think that's all that I had to provide relative to legislation or items that came up from legislation that we're working on right now.
Okay. Thank you, Brian. All right,
You do have one hand raised, Miss Melinda Elliott.
Miss Elliott, you have the floor.
Hello, Brian. I've talked to you a couple of times about families that I work with and myself that have waivers and that have problems with Medicaid.
Mhm.
And I just wanted to come back and report I'm doing the Medicaid dance again with Domino, and it's going really, really well. And I'm getting a whole lot less calls from parents. So I just wanted you to know.
Well, that is great to hear, Miss Elliott. But still, I'm thrilled that it's going well right now. But if you ever hit another hiccup or if something happens, please reach out to us and let us know.
Okay, thank you, Miss Elliott. Okay, any more questions for Brian? Miss, okay,
No hands
Gary,
raised.
I'm sorry,
I'm sorry, Jill, you have no hands raised.
okay. Gary, do you have any updates from OAAS that you would like to share with us?
Good afternoon. Yes, thanks, Jill. I wanted to provide an update on our PACE program for all inclusive care of the elderly. Can you guys hear me okay?
Yes, sir.
Okay. We just put out a RFI on yesterday. No, actually it was on Monday. We put out an RFI for PACE. If you recall, we had an RFI published previously, probably about 3 or 4 months ago for North Louisiana. But this one that went out on Monday is a statewide RFI. We're looking to gain information and gauge interest in opening PACE centers across the state. We are also, as a part of that, highlighting the Rural Health Transformation Grant and being able to open the alternative care sites or satellite locations, if you will, even in areas where there may be a PACE location. The goal would be for those alternative care sites to offer services in rural areas. Again, the RFI that was published previously for the North Louisiana, Bold Age is the provider or respondent that was selected, and they are in the process of solidifying a location in the Shreveport area. Once the location is solidified, then they'll be submitting documentation to CMS to move forward with the process of opening a PACE center in Shreveport, Louisiana. During the 2026 legislative session, there were an additional 750 community choices waiver slots added. And we are already working toward filling those slots. We previously mentioned that the department or the agency, we have been working with home and community-based services or HCBS strategies on information and gaining input as it relates to how we manage our community choices waiver wait list. We've since kind of got a final report from them, and we've submitted information to LDH EMT on how we plan to move forward. If you'd recall, our wait list is based upon a first come, first serve process, and we're going to more of an acuity based process based upon need rather than first come, first serve. So we have our preliminary overview of how we plan to move forward. And our next step is in the month of August, we're going to be hosting town halls for our providers and stakeholders. They will be August the 10th. We will be in Bossier for a town hall, followed by one on August the 11th in Alexandria. And then on August 14th, we will have a town hall here in Baton Rouge, kind of providing an overview of how we plan to move forward in our revamp process as it relates to our CCW prioritization process. And that's all I have.
Okay, thank you. Any questions before we move on?
There's a hand raised.
I'm sorry.
There's a hand raised, Miss Melinda Elliott.
Okay, Miss Elliott, you have the floor.
I'm sorry. So can you tell me the name of the agency you work with, you direct, and let me follow up?
I'm sorry, the agency we worked with on HCBS strategies as it relates to the waitlist reduction, is that what you're referring to?
No, you're from what agency?
Oh, I'm sorry, I'm with the Office of Aging and Adult Services.
Okay, so the follow-up. I don't understand what the relationship is between the Office of Aging and Adult Services and places like in my parish, the Calcasieu Council on Aging. Could you explain a little bit about that?
Yes, we have some of the same. We work pretty closely with the Governor's Office of Elderly Affairs and the councils on aging across the state. They fall under the Governor's Office of Elderly Affairs, whereas the Office of Aging and Adult Services falls under the Department of Health.
Yeah, okay, that's a big help. Thank you.
No problem.
Thank you. It's Bernard here, yeah, in the room.
Yes, he returned.
Okay, do you wanna give us your update? That is a lot of words. OIDDS. Is that correct?
Now, sure, I just have really two updates, so it shouldn't take longer than a minute or two. First update is tied to the rate study mini summit. We conducted that summit, what was that, Friday before last? We had a poll at the end where you had to take a QR code, and we collected all of those results. And we're analyzing those now, and next steps is to talk to executive management at LDH to finalize what scenario of the 3 scenarios we landed with, or we're gonna take. So once we get that down, we'll send out memos and information kind of sharing where we landed in terms of what we're gonna do with the rate increase and what next steps look like. So that's the first update. Next update, and this is more of a lookout for y'all. If you remember, as part of our value-based payment incentive model, we had an incentive tied to support coordination. What do we call it? It was a support coordination satisfaction survey, for lack of better terms. We worked with the value-based groups to determine and identify questions to include in that survey. That survey is about to go out if it hadn't gone out already. So what I need from you all is to let folks know that they'll probably be receiving emails to their email on file to complete that survey via SurveyMonkey. You probably also get communications of be contacted by your support coordination agency, asking you if you received that email and or trying to assist you all in completing that survey. Why is the survey important? The survey is basically what you all asked us for. It gives us a pretty good assessment of the quality of support coordination in terms of what they're providing. Are they checking the boxes for you all? And we'll take that data, analyze it, put out the findings, and then hopefully based on that, look for areas of opportunity to kind of enhance that service. So again, just be on the lookout. If you know folks, tell them, hey, check your emails because everyone has their own unique link. This only goes to waiver recipients, for obvious reasons, because if you're a non-waiver recipient, you wouldn't have support coordination. So it'll only go to waiver recipients, and it should go to the email on file. So if you either don't have an email on file, or you know someone who doesn't, or if you change your email, like reach out to your support coordination agency yourself and make sure they have all your they have all of your contact information, because they're working with us to make sure we get the survey to everyone. And that's it.
Okay, thank you.
Yeah.
All right.
Hold on, we got a question in the room.
If I'm allowed to.
Oh, I'm sorry.
I'm not.
Joe, Liam has his hand raised, and then Melinda has her hand raised.
Okay, Mr. Doyle, you have the floor.
Thank you, Joe. How long is the survey going to be active? How long are you accepting?
I think we're going to keep it up for 30 days.
Okay.
The reason why it's just 30 days, great question, by the way, is the incentive payment to support coordinators based on the performance score is tied to the ARPA spending plan, and that money dries up September 30th. I don't know if there's a better term for dry up than dry up, but we won't be able to access that money after September 30th. Got it?
Okay, thank you. Thank you, Liam. Miss Elliott, you have the floor.
Hello, Bernard.
Good afternoon.
How you doing?
Depends on what your question is.
Yeah.
Okay, so since the mini summit, or at least at the mini summit, there were a lot of us that didn't agree with the 2 choices on the poll. Tell me, because I probably just don't understand, how the ones that had a third choice are being folded into this decision-making process?
Yep, so that's a great question, Melinda, because that third choice wasn't on the poll because the poll was created before the third scenario was created. But we did document that, and the documentation we're sharing with EMT does include that. What would I call that? That, I don't want to call it a stipulation, but would also include that scenario for consideration. So yes, so we're not leaving it out, Melinda. It is included in what we're sharing with EMT, so they'll be made aware of the third option. Which when you think about it, and I know there's some people like, third option, what you talking about? So in the mini summit, for those who didn't come, there was advocates that propose a certain percentage of whatever was appropriated via House Bill 1 go directly or be reflected in the minimum wage salary of direct support workers. So just to kind of give you an example, let's say hypothetically, the rate increase based on the amount of money that was appropriated resulted in a 50 cents increase to all the services, right? What was proposed was that a percentage of that 50 cents be reflected in the minimum wage floor that's in rule. So right now, the minimum wage floor for OIDD is $9 an hour. Let's say if we said 50% of the 50 cents needed to be in the reflected through rule in the floor, that would go up to $9.25. So it's a scenario 3, but I really look at it as like in addition to in addition to the 2 scenarios that were presented, as opposed to its own scenario. And I see Brenton and Ebony shaking their heads, so I captured that right? There was some conversation around the percentage that should go to the rule. Some people said all of it. Some people said a requisite sample based off of what was in the rate study. So we have to iron all of that out, but we captured the spirit of the request. Does that make sense, Melinda?
Sure. So is your target still October or has that changed?
Yeah. Nope, still October.
Okay, cool.
Still October.
One more question. The survey about support coordination. I shouldn't have it yet. I should be looking for it, right?
Yep. And if you don't get it in the next 2 weeks, call your support coordination agency and tell them like, hey, do you have my correct contact information? Because those are coming straight from OIDD. So if we don't have your correct information in our system, you won't get it.
Okay, that was going to be my next little bit was, okay, what to do if they didn't get it. Okay, great. That way I can talk to my families. I appreciate you.
Yes, ma'am.
Okay, thank you. Okay, any more questions? All right, so now we
Brenton has
will,
his hand raised, Jill.
I'm sorry.
Oh, you're good, Jill. You can't see me, I don't think, where I'm at, so it's fine.
Oh, Brendan.
It's me, yes. For Bernard, I had a question. I guess it's a follow-up from the mini summit. So we had talked to some providers that had mentioned they didn't have the updated cost reports. I know there was a conversation during the mini summit about how they don't have to wait till November. They can get them in as early as they need. Actually spoke with some folks yesterday. They still don't have those cost reports. And so I guess I'm trying to understand. Ultimately, it boils down to we have to start, we as the council, we're thinking of our advocacy agenda. This is obviously something that I think we need to continue working on because we haven't achieved what we're looking to achieve yet. And so we're gonna have to start piecing together that part of what our ask is gonna be. I know the cost reports are something that's important to determine how we need to move forward with that. I know we are concerned, or I am concerned if things aren't in until November, we're not gonna have a great ask for budget purposes, timely, if you will. But if there's multiple providers from multiple agencies that are telling me they don't have the cost reports, I don't know, was that emailed to them? Some were telling me it's not even on LDH's website. It's on the website of the people that did the ICF study and not even the ones that did the HCBS study. So I guess I'm just trying to figure out when is everybody supposed to get the cost reports, or have they already got it?
They're already there. They're in the same spot that the cost reports have always been in
Okay,
for the last decade. So
Gotcha.
there's not a secret spot. So that tells me two things, and I'm not gonna fuss, is that most of the providers never filled them out anyway. They don't even know where to find them, right?
Okay.
They never changed the space. But just to be clear, like I believe, and Brian, I hate to put you on the spot, but correct me if I'm wrong. If you go to the LDH site and you go to the provider resource section, I think there's a link that brings you to where all of those documents and the instructions and the guides are housed.
okay,
Cause they're right, I think it is housed on the Myers and Stauffer. It's a portal that they made specifically for HCBS providers in Louisiana, so it's not like a general Myers Stauffer site.
gotcha.
It's a dedicated site to us, but that link is on LDH's site. It's in
Where the
same
other cost reports have.
spot. The same spot, yep.
And is there any training or anything on these
Yep,
new
they-
cost reports?
All providers should have already went through training
Okay.
because they had multiple training sessions. But there's recorded, I believe there's recorded webinars as well. Should be coming. The recorded webinars and the additional information should be coming.
Okay.
So I just want to make sure that's clear. There's the old way, there's the old training material, and then there's some new training material, but I don't know if they've done it for everyone. Because they've had pilot groups, so I'm kind of confusing things. They've done pilot groups with providers. So some providers have been trained and actually completed this, the cost report based on their feedback. That's how we were able to publish it. Did I miss anything, Brian, or did I misspeak?
That's true as far as I know. I was trying to find the link really quick just to
Okay.
see what was on the website. That's what I was looking for.
Yeah, I have it.
And so I guess I'm confused with, some have been trained if they were in the pilot, or they've all been
Yes.
trained?
Some if they're in the pilot, but the instructions and the training material is on the website for the
Gotcha,
new cost report. So
Okay.
you don't have to wait.
Okay.
Basically, is what I'm saying.
gotcha. And so is it still, I guess nothing has changed in the last week or two since we had the mini summit. Y'all are still doing a placeholder in your budget
That's my plan, yeah.
for
both.
28's budget. It'll be 27 session, but for the 28, okay.
For both, just so we're clear, and I guess and when I say both, I mean the rate increase per the rate study, as well as the state general fund swap for the stat debt
For the stat debt, yeah.
Remember, there's still both things.
And is that just the stat debts of what was done what was done this session dealing with rates? Or are you looking at all the stat debts that are?
The primary issue moving into the next fiscal session, especially since it's the fiscal session, is the now fund. If you remember, we
Right.
started all the major rate increases and the money appropriated for waiver slots tied to the most appropriate waiver. All of that was started out of the now fund. So that fund isn't a revenue generating fund, meaning it doesn't come from tax revenue like the DD trust fund. So if there's not a surplus in the state budget, that fund won't get funded. So what that means for that fund is that the money that's appropriated out of that fund, if it outpaces the balance, then we don't have the money to cover it. Which means several of the night rate increase, the $2.50 increase, the complex care rate, as well as some waiver funding will go away. So when I say both, I mean both, like the now fund, trust, the replacing that money and the rate increase. And I was saving that for tomorrow, you know, but I don't get any questions, but
should still say it.
gotcha. And I'm not trying to scare anyone, I'm just trying to make sure everyone's aware, to be transparent, what risks exist out there. You know, especially to DD Council, you all worked so hard to get that now fund structured the way it is. It's important to share like long-term stability of that fund. And I don't think we intended, you all specifically, to have that fund produce money for recurring obligations. Meaning like for bills that come every year. I think that's not what the design of that fund was for, or maybe it was. I wasn't intimately involved when we got the language reworked, but it's important to note that there's several obligations out of that fund that have an annual bill to them. And we need to make sure we make an effort to start moving that means of financing or that money to other buckets, so we don't have to lean on the now fund to cover those bills. Any questions on that?
There's one. Jill, Miss Melinda Elliott.
Okay, Miss Melinda, you have the floor.
Thank you again. I appreciate it. So I understand that some things in the past that were recurring came out of the now fund. But in the past legislative session, the money that the legislators appropriated, that didn't come out of the now fund?
No, ma'am, it came out of a different stat debt, a different fund.
Okay, so there's questions about the amount of money being enough in the now fund for some things that we've already worked on. And then more money for rate increases. Okay, I think I understand. Does that sound right?
I'm not sure. No, I'm just joking. That's right. I'm just joking.
All right, thank you. I appreciate y'all.
Yes.
Okay, thank you, Miss Melinda. Any other questions? Okay, so we're moving on to contractual activities it's in your packet, your status report. Stephanie, would you like to start us off?
I will start with partners in policy making. So partners in policy making, that's activity 1.1.1. They had 22 applications for the 2026 partners in policy making class. In June, they had 18 participants graduate. 6 of those were self-advocates. We are right now planning the debriefing, which is just kind of like our end of the year talking to with the partners in policy making coordinator to just kind of plan the next partners in policy making class, so the 2027 class. The 2027 application will be coming out soon. The hope is to have it out at the beginning of August. I believe Rebecca wanted to have it out August 1st. That was when I spoke to her last, that was the date that she gave. She was trying to confirm one last date with the hotel, so I haven't gotten an update in a couple of days, so I'm not sure if she was able to confirm that date yet. But I will definitely have that update at the next council meeting. And once that application goes out, it's usually out for 30 days. So the application goes out for about a month. So it'll be out until September, and then sometime in September or October is usually when they have a selection committee. So Partners in Policymaking, the PIP selection committee, they have a selection committee where they have a committee of PIP participants that select the next partners class. And then that those selected and alternates, they receive the agreement and things like that with the dates, and it begins in January. So once I have all of those dates and everything confirmed after our debriefing, the website will be updated. We'll be sending out that LADDC news with the dates and the application and the graduating class picture. We did send out in the annual report picture. Oh wait, no, that was last year's. Sorry, I'm getting all over the place. Trying to keep the year straight. But so we will be sending out a LADDC news with the graduating class, their picture with the as well as the application for the upcoming class once we have those dates set in stone with the hotel. Are there any questions about Partners in Policymaking? I know I gave a lot of information, but there was a lot that happens at the end and the planning coming up. Okay, I'll move on to YLF. I'm also going to give a lot about that too, because the YLF also just happened. It happened, I don't know, at the beginning of July, maybe a couple weeks ago.
Second weekend.
Yeah, and so it was, there were 18 staff, 11 delegates. I think when I was there, I believe that there were 10 delegates total. It was July 9th through 12th at LSU East, so LSU Eunice, and they had, it was great. We are also planning a debriefing coming up. Rowan was out of town, so we're trying to plan a debriefing coming up again, kind of like the same thing with the Partners in Policymaking, with figuring out just like what worked, what didn't work, things that would change. So with the Youth Leadership Forum, it was I got there on a Thursday. Yes, it started on Thursday. It lasted until Sunday. Every day they had different sessions. They ranged, and I know in the previous quarter, like I think in the first quarter status report, we kind of give more information about what the different sessions are about, but there's sessions on dating and relationships, disability history, there's a Capital Day. They met with the Secretary of State to learn about voting rights. They were able to actually do a demonstration with the voting machines and learn about voting accessibility. That's just to name a few of all of the great sessions that they did have. And then also it is hosted on a college campus, so they get that real life college experience of being away from home and on a college campus. So it was a great weekend all all around. I had fun and didn't even sleep there, so. Are there any questions about YLF? I'll have a better update once we do have our debriefing scheduled, but like I said, it was just at the beginning of July, so really the update will be more on the Q4 status report, but because it just happened, I did kind of want to give you all a little bit of an update and let y'all know about it. But once we have that debriefing, I'll tell y'all more about, what's upcoming within the next YLF session and things to look forward to and all that kind of stuff. The next activity is activity 1.1.8, and that's the abuse, neglect, and exploitation training. I also have a little chart, sharing that chart. It's just a little summary, like an attendance summary of all of their training so far. So they did have one at the beginning of the month in Lafayette, but at the time I didn't have the data. I did just receive it. I just didn't have the time to input the data yet before this meeting. So, right now they have scheduled all of their training so far. I did send out a LADDC news that on June 5th for all of the July trainings for the action against abuse and their other activity, which is their transition to adulthood, that Team Dynamics puts on. So it's just like a little snippet of all of their trainings for July, and then I'll do another one for all of their August trainings. Just so that way I'm not sending out one for every single training, logging down their emails. So I sent those out. They have one coming up tomorrow. Oh no, I'm sorry. It's today. And then the next ones are in August in Monroe and Shreveport in the north. So are there any questions about the action against abuse? Activity. Oh, I'm sorry. I see that Brian's hand's raised. I'm in charge of the hand raising and I'm talking about this and I'm so sorry. And I see and Rowan has their hand raised also. I'm so sorry. I'm talking and I have stuff pulled up on my computer and I don't see the hands and I'm in charge of the hands. So I'm so sorry.
I'm in charge of calling them and I'm about to go to sleep.
And it's my fault, Jill. I'm so sorry because I just keep talking and I'm supposed to be also looking at my screen. So I apologize and I don't know who had their hand up first because I had something pulled up on the screen because I didn't.
Brian's on.
Well, Brian's a committee member. So, Mr. Bennett, you have the floor.
I just had a quick question. Is the vendor producing any training materials or are they just in-person workshops?
The action against abuse.
Yes, yeah.
They have materials, so they do have resources, they have PowerPoints. Are you
Well,
looking
just
for like a
if any
resource or-
stakeholders wanted to share the training with any individuals, would that be possible, or do you have to attend an in-person training in order to access it?
I think At this point, I would say you would have to attend it until our contract is up. And then
Okay.
we can make them available, because we do have access to all of those training materials, but then we can make them available to the public, yes.
Okay.
Do you all agree with that statement? Want to make sure Brent didn't have any.
Repeat your statement.
The materials,
Tech issue.
the action against abuse materials and resources that they use for the training. He was asking like if stakeholders wanted that information, if they would have to attend that training, or if it could be made available. And I said, well, at this point, they would have to attend it until our contract is up, but once it is done, it could be made available on our website. Do you agree with that?
Yeah, I mean, if
Yes.
Team Dynamics produces that information, because I don't know what, I haven't actually been to this iteration of training, so I don't know what resources they leave the training with, but those we could ask for them to
Some of it is like,
be able to allow us to share that.
yeah, and some of it's scenario based, like they go over scenarios, there's some videos. I did the training last year. I'm not sure how much of it has changed. Just because I have not gone to this year's. But yeah, I can talk to them and find out, Ryan, and if it is something that they can kind of package for us, I can make it available.
Okay. Thank you.
And
And Rowan has her hand raised.
Oh,
Your hand raised.
Rowan, you have the floor.
Hi, everyone. Thanks for the opportunity to speak. I am your Louisiana Youth Leadership Forum Coordinator, and I just wanted to say thank you for funding training like this. I do want to say that I would really love personally to see more self-advocate and family attendance, because through YLF, we have really seen the prevalence of abuse in our community. So whenever you run a summer camp in Louisiana, all staff are what's called mandated reporters. And so if our staff hears any disclosure of abuse from any of our delegates, they are mandated to report that. So we specifically train to identify what a disclosure sounds like, right? And how to go through that reporting process. And in our 4 years of running camp with an average of 10 to 12 delegates per year, we have had 5 mandated reporting incidents, varying in levels of severity, which if we have a total of 40 to 45 delegates over those 4 years, right, we're looking at 1 in 8 delegates, 1 in 9 delegates facing abuse at home. So this is a pretty significant issue that we know is backed by statistics, and really this is happening within our family units. And so I think with this information, it's really important that we really get more self-advocate and family engagement. So thank you.
Sorry. Thank you, Rowan. Hold on. Okay, any more questions?
Jill, I'm sorry, the only other thing that I would like to add, and it was just to, I do want to I agree with what Rowan says completely. I do want to just state that the activity specifically does say to educate and train individuals with intellectual and developmental disabilities. Like that is the main point of this activity. And I know that it also includes caregivers and families. I'm the person that does all of the reporting, like the federal reporting. in case y'all didn't know, and I probably talk about it all the time though, so y'all should know that. And it's all the time that when I am looking at the numbers, the number of self-advocates is always the lowest. It does not matter what the activity is. It doesn't matter who it's geared towards. It is the lowest number of participants. And speaking to other councils, it's kind of across the board. And maybe, I don't know, I think we just need to really brainstorm with the council and other people, maybe other councils, other council members on how to get a good reach. And I know I'm kind of going off on a tangent, but that just really made me think about it, Rowan. Is that is like one of our biggest struggles, is really reaching individuals with intellectual and developmental disabilities and making sure that they're aware of these opportunities and actually going to these activities and trainings and any trainings that we're putting on and knowing about the opportunities that are available. So other than that, that is all that I have for my reports. Unless you have any other questions.
Okay, any questions for Stephanie? Okay, wait, hold on, I lost my paperwork. Okay, so thank you, Stephanie. Now, Rakisha, can you give us an update on the next few activities?
Yes, ma'am, I sure can. So the first one I have an update on is LaCan. So LaCan currently has 5,989 individuals registered for the council and LaCan listserv to receive information and action alerts. Since October 1st, we've had 16 action alerts with 1,535 actions taken. We've had a total of 7 yellow shirt days, 189 people in attendance to those yellow shirt days, and we've had 12 testimonies given. They also participated in Disability Rights Day. They had 58 people in attendance. As far as trainings, on June 25th, LaCan leaders and FHF directors participated in the legislative session debriefing to discuss ideas and strategies for improving advocacy activities and its effectiveness for 2027 legislative session. They also continue to host 2 LaCan leader conference calls per month to discuss current concerns and issues and develop advocacy strategies. For legislative visits, they did a total of 73, and 42 of those were key member visits. They also completed a total of 170 informal visits in addition to those legislative visits. And that was with legislators to discuss their advocacy agenda. And it is actually community input time. So we have community input meetings scheduled for all regions. These meetings provide an opportunity for members in the community to have an open discussion about the issues and concerns they have about in their region. So this is what you guys use as recommendations for your next legislative advocacy agenda. So please make sure as members of the council and leaders in your community, you attend and participate in your regional meeting. So please get with your regional leader for more information. And the dates and times of all of those meetings are actually also on our website. So that's all the updates I have for LaCan. Any questions? Okay, if not, I'll move on to Families Helping Families. So since October the 1st, There have been 25,735 individuals and with disabilities and their families supported. Over 40,628 units of information and referrals have been completed. 325 trainings have been conducted with 6,397 attendees. 436 outreaches have been conducted at hospitals, pediatrician, school districts, applied behavior analysis clinics, and also physical therapy clinics. Within the next few months, we'll be conducting audits with all Families Help and Family Centers. Well, all 9 of them, I'm sorry. The results of those audits will be provided in the next quarterly meeting. Since our last quarterly meeting, Families Helping Families in Acadiana, the Lafayette area, they are currently in search for a new executive director. If you're interested and would like to apply, you can go to their website. I'm sorry, not their website, you can email them. info@fhfacadiana.org. So until someone's hired, Terrell Bergeron is serving as the interim executive director. So on the flip side of that, Families Helping Families in Greater Baton Rouge has hired a new executive director. That's Miss Stephanie Ashford. So we would like to definitely welcome her to the team. Any questions for Families Helping Families? All right.
Okay, no questions, Stephanie?
Nope, no hands raised.
All right, so I'll keep the ball rolling. The next contract we have to discuss is with LSU. I know the last time we spoke in the last quarterly meeting, we had not really gotten any information from LSU. So since then, we got some good news. They have been working. So for the first initiative, which is the HEART initiative, that's sex education. Just to remind you guys, the council contracted with LSU on this initiative to develop a universal design comprehensive education curriculum for individuals with intellectual and developmental disabilities, families and professionals to navigate through sexual development, build healthy relationships, and achieve lifelong sexual health. They agreed to draft and create materials and host 3 co-design workshops to include 15 to 20 adults with intellectual developmental disabilities, caregivers and experts, and also to pilot lessons in at least 3 Louisiana school districts. So since February, they've completed recruitment flyers for their workshops. They completed the co-design team recruitment, and they are currently in the process of working on creating workshop protocols, drafting curriculum lessons and materials, and recruiting workshop sites and participants. So according to the coordinator, they are on track to meet the deliverables of this contract, and we'll keep, of course, reporting out to make sure you guys are updated on this initiative.
Okay, thank you, Rakisha. Any questions?
There's one hand raised, Miss Melinda Elliott.
Okay, Miss Melinda.
Must have hit it by accident. I'm so sorry, Jill.
Don't be sorry.
I thought you had something for me, Melinda. All right, so I'll keep going with the last initiative I have. That's Women's Preventative Health. That's the HER initiative.
Okay, I'm sorry. My script is, I didn't follow that correctly. I'm sorry, Keisha.
That's okay. So just to remind you guys, the council contracted with LSU for this one to develop plain language and visually supported resources to address critical gaps in women's health identified by the CDC, which is the Center for Disease Control and Prevention, and NHI, which is the National Institute of Health. They agreed to draft 10 health toolkits, 3 fully validated and available online and in clinics, and 7 for future piloting. with 100+ downloads and 30+ QR scans to be distributed and shared over 200 Louisiana women with intellectual disabilities. So since February, they completed recruitment flyers for their workshops. They completed the topics for her health toolkits, and they're currently in the process of creating workshop protocols, creating a visual and plain language style guide, and creating 3 complete toolkits. So again, according to the coordinator, they are on track to meet the deliverables of the contract, and I'll keep you guys updated. That's all I have.
Okay, thank you. Okay, so I have a question. What order did you talk about? Like, cause the last update was that 2.12 or 2.31?
It should have been, the last one was 2.31.
Okay, cool. Thank you.
Yes, ma'am.
All right, so okay, any questions before we move on to our final activity?
We have no hands raised.
Okay, Brendan, do you want to take us home?
Sure, so this is activity 2.1.3. This is the navigating the system co-occurring disorders activity that we partner with the ARC of Louisiana to do. This is the 3rd year of this activity. It's actually the final year. It's not continuing next year. So if you haven't been on one of the trainings yet, you're interested in attending, certainly now's your chance. For those of you that may not know, this particular initiative really focuses on educating the attendees of this training on those services and supports that are provided on the behavioral health side, the developmental disability side, and looking at those managed care services as well. And really just making sure that you kind of understand how to navigate each different system based on the particular needs that you have. And this year there was a wellness component that was also added. That just focuses on general wellness and understanding kind of how to make a wellness plan for yourself. To date, there have been 138 individuals trained. Almost 70% of those, right at about 94, are individuals with disabilities, which is great. There's really been a push this year to focus on folks with disabilities and not be so heavy on our family members and our professionals. And this contractor was able to do that by going to provider agencies and hosting trainings there, looking at day programs, really trying to bring that training to where individuals are as opposed to waiting on them to come to you. This quarter, they were able to conduct trainings in the Houma Thibodeau area, the greater New Orleans area. They also did a training in Northwest Louisiana, kind of Shreveport area. They are currently in the process. Some of the areas that they have left to go would be the central Louisiana area, Alexandria, Pineville, that central area. They're looking at getting those trainings scheduled. They're also going to go into the North Shore area. Next week on August 5th, they have their Region 4 Acadiana area training that's going to be happening. And they also have a statewide virtual training that's going to happen on August 13th. So for those people that can't actually go to a training, or maybe you missed one that was near you, you could attend that virtual training that's going to be on August 13th. So you can go to our website, check out the latest news section, and that is going to have the LADDC news articles that we've shared for those 2 trainings, August 5th and August 13th. Those are also on our Facebook page. And it'll tell you how to register for those. You can scan a QR code, you can click the link to get registered. Again, these trainings are free. You just need to register. That way they know you're coming and they have room for you and they have the materials for you. We continue to get good feedback from participants, particularly around the wellness component. Everyone leaves this training with a wellness guide or a wellness plan, so you can actually create your own plan and bring that information to your family, your sport coordinator, your doctor if you want to. Just so you can kind of understand exactly what areas that you should focus on for good health and what areas you may want to focus on. There's been a lot of great feedback, a lot of folks saying, that they've been able to go and advocate on their own behalf after attending this training on their own health needs. So we're really getting some of those outcomes that we're looking for with this particular component. That's all I got.
Okay. Okay. Why can't I just keep my papers in front of me? Okay, thank you, Brendan. Any questions for Brendan before we move on? Stephanie.
No, I'm sorry, there are no questions.
Okay. Okay, Rakisha, will you please provide us, provide the announcement?
All right, please note that after this meeting, our Act 378 committee meeting begins, starting at 2:45, followed by Education and Employment Committee meeting at 4:15. Also, tomorrow is the full council meeting. It will start at 10 a.m. It will be in this same room. Those that have registered to participate virtually should have the links to the meeting in your email. That's all the announcements we have so far.
Okay, thank you, Rakisha. Okay. Does anyone on the academy, Sorry, does anyone on the committee have any other announcements to make?
Jill, I'm not on the committee, but can I make an announcement?
Yes, you can. What?
I didn't announce this at the executive committee meeting, but I want to make sure I announce it at each other committee meeting we have today. The executive director of Medicaid will be here tomorrow for a presentation about the upcoming work requirements, the changes that are going to be made to Medicaid. And so I encourage everyone to attend. Tell your friends and family to attend. Just so you have that information, and if you have any questions, he'll be here at our meeting to answer any questions for you guys. So please be in attendance.
Okay, I'm scared now. Like, Brian, do I have to work more than 8 hours a week?
You're good, Jill.
Okay. I mean, I work way more than 8 hours a week, I promise. Okay. Thank you, Ebony. Alright, is there any public comment?
Public comment.
Alright, I hereby adjourn the meeting at 2:09. Thank y'all. See y'all tomorrow.
Thanks, Jill.
Thank you, Jill.
Bye, everyone.